Hi everyone, I am Stephanie with Nine Health. September is National Recovery Month, so I wanted to touch base with several experts. We've partnered with the Colorado Department of Human Services Office of Behavioral Health, and they've provided us with all of these experts today. Nine Health expert Dr. Paul Coley will be joining us in a few minutes as well. So we just wanted to, talk about this topic because with the pandemic, people may be using substances more, or maybe they've started using substances again if they were recovered. So we want to talk about the resources available in our state. I want to introduce all of these experts. I'm joined now via Zoom by Michelle Ryan. She's the Regional Outreach Specialist for the Colorado Behavioral Health Group. Mark Condojani, he's Director of Adult Treatment and Recovery with the Colorado Office of Behavioral Health. Taylor Wright is a Senior Outreach Coordinator for Oxford House of Colorado, which is a recovery organization. Kim King, she's State Opioid Response Grant Peer Navigator with MindSprings Health. Osvaldo Cabral, and he has Ozzy on there, so I might refer to you as Ozzy, Director of Integrated Services at New Health Services, and of course, Nine Health expert, Dr. Paul Coley, who's a cardiologist, but also an expert in internal medicine, preventive medicine, kind of our good all-around expert to chime in on topics as well. If you have any questions for these experts, please post them in the comments and I'll pass them along. First, I want to talk about what the term recovery means, and especially with relation to Recovery Month. All of our experts can chime in on this, but Michelle, I want to start with you. Just tell us a little bit about what recovery means.
Recovery is a opportunity for people to recover from the effects of the damages done by substance use. It's also a way of living that provides a healthier way of living and a community to help with people that are trying to learn to live a new life. Living in the life of chasing the drugs takes time and takes a community to help get out of that rut, and recovery offers that in millions of different ways. And for me, recovery is a new way of living, a healthier, safer, more fulfilling way of living.
I think that's a great way to describe it. And Mark, I don't know if you want to add to that, but also tell us ways people in recovery can find support and some of the resources available.
Sure, thanks. And recovery from addiction can be a challenging journey for anybody. I think it's probably become more challenging during COVID. Addiction can be an isolating disorder, and connection is so important for people to get into recovery. And that's been limited, but there are resources available. There's plenty of organizations for people that are already in recovery, people that are wanting to get into recovery that need treatment. Those are available as well. But I want to focus on recovery for people that are already on that path, but maybe they're feeling isolated and need some additional support. There's organizations like Advocates for Recovery. And I think we'll be able to share links for all these organizations. The Phoenix for people that want to focus on health and fitness with other people in recovery. That's another great organization. Young People in Recovery for younger people. They're active throughout Colorado. Springs Recovery Connection. These just are some examples of recovery community organizations. And I know we have Taylor here and he'll be able to talk about Oxford House, but there's lots of recovery housing that's available as well. And right now, if someone is in recovery and maybe they've lost their job and they're feeling the stress, but they want to hold on to the recovery and they need a supportive place to live, there's funding available to support people through our office to live in a recovery residence while they try to get reemployed during this difficult time.
Yeah, it is a very difficult time. And again, we're talking about Recovery Month. I wanted to connect everyone with a lot of experts. We're working with the Colorado Office of Behavioral Health. Taylor, since Mark kind of brought you up, I'll let you talk about the Oxford House now. Tell us a little bit about what that is and add to some of the resources there.
Certainly. So Oxford House is an evidence-based, self-supported, democratically ran recovery home. What that means in its most basic form is that the members ultimately decide the day-to-day based on what the Oxford House model is, and they support each other. They hold each other to a degree of accountability. They make sure that every member in the house is abiding by a healthy form of recovery, whatever that recovery looks like. I'm very fortunate to say that we have 85 homes across Colorado. And that stretches from Fort Collins down to Pueblo, and then across to the western slope as well, and all areas in between. It's very easy to get into an Oxford House. It's very easy to stay in an Oxford House. A few things that entails are, of course, remaining sober. We are 100% abstinence-based. There is no towing the line, as far as drug use or alcoholism goes. So it's very important that you know that if you want to entertain membership in an Oxford House, that there is no in between on that. We have an Oxford Vacancies website, and that is the most valuable resource to most everyone I've found. It's a link that can send you to any house that you might be exploring throughout Colorado. There's an individual house number, there's an individual contact number for each house, so that you have multiple ways to get in touch with any one house. It's a very short application, and most times the house wants to conduct an interview to decide whether or not you're a good fit for that particular house.
And Ozzy, I wanted to let you just talk about New Health Services with where you're from. Just talk about what that organization is and resources available. Oh, and now I can't hear you. We heard you great earlier.
Can you hear me now?
Yes, now we can.
Okay. So New Health Services is a chronic and acute pain clinic that's integrated with behavioral health. So we have physical therapy, surgery center procedures. What we try and do is really reduce the amount of opiate medications, and we use behavioral health and other modalities. So every patient that comes in to see a medical provider for chronic pain has to be paired with a therapist and has to be working with distress tolerance skills and good monitoring.
And we're going to just kind of keep talking about resources available. Someone did just say, and I'll give you a chance to answer this, Taylor. Someone said that Oxford House allows tobacco. Do you see that as being an issue or as a substance? So if someone's trying to, if tobacco is one of their substances, should they not be a member of Oxford House? And you're still muted, sorry. Oops, sorry. And I just muted you again.
There we go.
There we are. Sorry about that.
Tobaccos are very common. I don't know what you would call it in an Oxford House, but a lot of our members are tobacco users. If there was an instance where any individual did not want to be around that, then we could certainly direct them to a house that would be at the very least open-minded to not entertaining tobacco use in that one particular house.
Okay, yeah, I thought I'd just bring that up since someone just asked about it. And Dr. Coley, mental health is a big aspect of substance use and recovery, obviously. Can you talk a little bit about the resources that 9 Health has available and how mental health really does support someone in recovery?
Addiction and mental health problems are so complex, and physiologically in our brain, they really do get our brain rewired. So the road to recovery requires, a lot of attention, time, and patience, and it's really great to connect people with the right resources. And to that end, 9healthfair.org has created a mental health platform where you can access remote mental health services for free all over Colorado. And I think that's really the first step. And then, of course, many of the things we're talking about today in terms of the longitudinal long-term plan are really important as well to kind of continue along that path. And often for mental health and recovery, you really do need a multidisciplinary approach. So, just one treatment or one therapy is often inadequate, and it really doesn't work for everybody. So you want to try to approach it from many different angles, including behavioral therapy. Sometimes we talk about pharmacologic therapy, like medications that can help you get off of cigarettes or alcohol or opiates or whatever it is that you're struggling with getting off of. And then of course there's also lifestyle changes, programs and such that can help you stay off of those. So I think really approaching it in a holistic fashion, being patient with yourself and recognizing that it's a complex disease and it's going to require some time to undo the signals that have been created in your brain.
I'm looking at some of the comments we're getting on Facebook as well, and people are talking about, obviously recovery is easier if you have insurance, but I'll ask you quickly, Taylor, Ozzy, the places that you guys are at, are there, you know, are these free programs? Do people need to have insurance? Maybe just address that.
Well, to tag along with what Mark had to say a minute ago, there are a lot of resources, financial resources, moreover, that a lot of people can access to help gain, particularly in my situation, you know, access to membership within an Oxford House. And I know that stretches across many different organizations. You know, as far as, I forgot the question.
Oh, we were just addressing whether or not insurance is required for receiving some of these services. You know, they have
They
this
do.
financial support.
They do not in Oxford House. We're not attached to any insurance institutions, anything like that.
And Stephanie, can I chime in as
So-
well?
Yeah, of course.
Yeah.
Just on the insurance front for behavioral health services. Again, if you have Medicaid or if you're unemployed and you may be eligible for Medicaid, Medicaid covers a great deal of the behavioral health services. It's a really strong benefit, including if you're struggling with opiate use disorder. All the medications that Dr. Coley was talking about are covered under the state Medicaid plan. So that's important. And if you're uninsured and you're below 300% of poverty, our office has money that's available to support people with addiction treatment. So I think cost shouldn't be a barrier for people. And if it is, they can call the statewide crisis call center and help get connected to a provider that will accept some of that funding that we're talking about.
Medicaid doesn't really pay for long-term inpatient treatment, and so there are some treatment centers that are free. I mean, there's Stout Street Foundation, there's Harbor Lights, there's Step Denver. So there's different places that they can look at and find. There's definitely resources. You can also ask for scholarships. You know, I think if not having insurance or money is an obstacle, call some people, ask around, see what resources we can refer them to.
Yeah, and someone did say, you know, most office behavioral health programs don't cost anything, or they're very good about finding, you know, resources for you. So it's, people are getting it. Tim, I want to bring you in. Someone did just say many find recovery without some of these treatments, just using peer support in their community. Maybe just talk a little bit about why peers are so important in the recovery journey.
So I think that, you know, I work at a community mental health center, so there's a lot of different aspects to peer support. You can access peer support through, you know, I work at Mind Springs or any local community mental health center in your community. Or there's also, I mean, you can go to AA and NA and get peer support there, or Oxford House, or an All Recovery meeting, or Advocates for Recovery Colorado. There's a lot of different options when it comes to peer support and what that really looks like. But the basis of being a peer is somebody that's been through similar situations as you're going through right now. You know, I myself am a person in sustained recovery, and that gives me a little bit different perspective when helping people than maybe like a clinician or a therapist would. And it really helps, I believe it really helps reduce the power differential between client and professional. And you can really meet somebody where they're at and be on the same level and come alongside somebody and hold their hand and walk them through the really tough stuff. So that's why that's what I really see peer support as, and how it's really beneficial for people in their recovery.
Yeah, and Taylor, maybe you can add to that. And then I'm also just curious, you know, how the COVID-19 pandemic has affected people in recovery.
I can say in Oxford House and in the community as well, outside of just being in any one Oxford House, I've seen that individuals in recovery have really adapted to a digital platform for meetings and even treatment-related resources through clinical care. It's been really positive to see in the midst of a somewhat dark time that we're all having to deal with. But our members in particular, they have rallied together to attend meetings together to ensure that the resources that are available are utilized to their full potential.
Dr. Coley, just speaking a little bit about COVID-19 too, talk about substance use, what you've seen, what you've heard, any studies that you've come across as far as how substance use has changed and even recovery has changed with COVID-19.
So, the CDC has identified a few key high risk populations for increased substance abuse during the COVID-19 pandemic. And there are really no surprises there. It's really the people that you would expect. So, people who've had a prior history of substance abuse or mental health problems, obviously higher risk at a time when we're more socially isolated, we're more lonely, there's less engagement, less ability to reach out for services, and it's harder to do everything that we do on a day-to-day basis. The second group is the group that's high risk for having complications from COVID-19. So those are the elderly patients. Now, we already know that loneliness is an epidemic in this population. And again, because of COVID-19, nursing homes and assisted care facilities, many of those have cut out visitors, which was a huge part of engaging with the community. So this population is obviously higher risk for mental health problems, substance abuse, and undiagnosed substance abuse, again, because of their demographic. And so it's really important to pay close attention to this population. And then finally, kids, teenagers, and adolescents. You start to think about that as a high risk population as well. So kids and toddlers, you often see mental health problems such as acting out or regression occurring. Whereas with adolescents, we're seeing a lot of substance abuse going up as well. Unfortunately, substance abuse in adolescents most commonly occurs in substances like vaping, which has really become an epidemic in this community. And there was a study that just came out that was from Stanford that linked vaping to 5 times higher risk of contracting COVID-19 if you've ever vaped, and a 5 times higher risk of having symptoms with COVID-19. So actually having a more severe phenotype of the disease. So I think we really do have to pay attention to these high risk groups, but really at the end of the day, we have to pay attention to everybody during this time, because of the isolation and the change in social behaviors and the impact that it's going to have on our coping ability. And often substances are what we use to cope.
Yeah, the loneliness, I could see definitely being a factor for a lot of people, and we all need to be really taking care of our mental health right now. Michelle, can you just talk a little bit about how we support our friends and family in recovery during this time? It is a little hard, like Dr. Coley said, to be social with some people right now, but how do you support those friends or family that are in recovery?
So there's lots of programs for friends and family as well as for the addict themselves. And it's really, really important for friends and family that have loved ones that are suffering from substance use disorder to get connected to other friends and family who have the same thing going on with them. And there are groups like Al-Anon, and OBH also has a program that they support called CRAFT, and I can't remember what that stands for. Mark, you probably know it. And that is a program that's a 16-week, I think, program, and it's free, and it gives a lot of support around how to help somebody that is suffering from substance use disorder that hasn't yet got into treatment or is already in recovery, and how to support their recovery. It is a family disease, and without treating the whole nucleus of the person in recovery, where their friends and family are concerned, there's less likely chance of long-term recovery for that person. It's really, really important. I'm also in recovery myself, have been for a long time, and I also participate in Al-Anon, which is the program that I have found to be the most helpful for me and my family. I have 2 kids that are both in recovery as well. So it's just been vitally important to be able to connect with other people that are having the same kind of concerns with their family members. You find solution there.
Mark, I don't know if you want to add to that a little bit. And she was talking about the CRAFT program with OBH, maybe address what that is.
Yeah, absolutely. So that's another evidence-based model. It's community reinforcement family therapy. So it really is targeted towards the family member that's struggling with, how do I help my loved one? I don't know what to do. I'm frustrated. It gives them skills. It gives them supports just so that they better understand what their loved one's going through. It gives them tools for their own coping so that they're kind of in a better place. And what's exciting about the program, in terms of that loved one, is that it has a really high rate of being able to help families that go through CRAFT have a very high success rate of being able to get their loved one to engage in treatment. So it gives them some tools to bring up the discussion, provide support and love, to their loved one, and also help direct them towards the help so that they can get onto a path of recovery themselves. And we do, again, we have grant funding that is supporting this throughout the state. I think we'll make this resource available so that people can kind of get phone numbers and locations. And I think, as Taylor and others have said, in this age of COVID, many of them have adapted. And so there's the ability to kind of remotely patch in and participate until we can all get face-to-face again safely. So it's available right now. It's operating in a lot of communities, and we hope to grow it even further, but we'll get that information out.
Yeah, and the Colorado Department of Human Services just commented in the Facebook comments with the link to the CRAFT program if anyone's interested in learning more about that. Going through the comments, Mark, I wanted to ask this to you as well. Let me find it again. And Kim, maybe you can add on to this too, or Ozzy. Daryl said, "We are not bad people trying to be good. We are sick people trying to get healthy. He didn't do rehab. He got clean and sober in his 12-step program. But that being said, says he believes rehab's an effective tool that helps others, but not the only way to do it." So I guess maybe the difference between some of the programs. So it's not just rehab, but maybe there's other things people can seek out as well.
I think it's a beautiful comment. I think that what we need to recognize is there's many pathways to recovery. Some people are able to do it with self-help support. Some people through their faith community, and then some people are going to need professional help. So we need to make sure it's available for those that need it. In fact, all these resources, whether it's peer support, recovery housing like Oxford House, or formal treatment for the people that really are going to require that. So we want to support all pathways and make sure that that there's resources to support people to get the help they need when they need it.
I think that comment really just speaks to the support system of recovery and how important it is. I mean, if you're around people that are excited about recovery, that they're connecting to the world in a whole different way, then you can kind of tap into that. And really, I mean, when you look at 12-step, I think treatment is really super important for many people who sometimes you need to get off the streets to get away from the drugs for a while, because for some people, as long as you're out there, you're going to use no matter what. And, any modality that you use is really caught into the 12 steps as well. Cognitive therapy, all those slogans, meaning makers make it, keep the plug in the jug. Those cognitive restructuring, right? The humanistic approach is there. Dialectical behavior therapy is integrated into 12 steps. And so, so that therapeutic process is there, and to tap into that is huge. So regardless of where you're tapping into it, it's very similar. I think a lot of people don't recognize the 12 steps as with all those therapies involved in there, and that mindfulness base that is really part of it. So you'll get all of that through fellowship, and you'll get support. And I think that's just the big thing, is finding treatment and finding some social support system that you can connect to.
Yeah, I'd like to piggyback on that. Yeah. It's just finding what works for you. You know what I mean? What worked for me in my recovery might not work for the next person in their recovery. And, and that just goes into like our life experiences and the way that we view the world and different things like that. So, 12-step is great, and it's been there for a long time, and it's worked for a lot of people. All recovery meetings are out there, and finding one of those, and faith-based. There's so many different recovery supports nowadays than there even compared to 10 years ago. And I think that Colorado has done a really good job at facilitating, making sure that there are more options for people. What else? I think that's all I got.
Well, and I was going to ask you too as well, if you want to touch on this, but just if we notice substance use in a loved one, or if we're trying to seek help even for ourselves and recognizing that, what should people do?
Especially with COVID going on, if you know people that are in recovery, make sure you're checking on them. If you haven't heard from your friends that struggle with alcohol use disorder, make an extra phone call that week, stop by their house and see if they want to go for a hike or whatever it is. Just make sure that you're checking on your friends. If you can always call. My biggest resource that I try to pass along to people is Colorado Crisis Services. And I think that you guys are going to share a link to the phone number. They're an amazing resource statewide that whether you live in Durango or in Fort Collins, you can call them. It's 24 hours a day, and they can give you resources, whether it's residential treatment options or family support for craft group, or whatever it is, recovery and substance, and I believe mental health also, resources you can get from them. So that's my go-to for anybody that's needing help.
Yeah, and you
Good
can
person.
call or text, which is nice. So I'm going to put all that in the comments right now so that people have that information. Taylor, I don't know if you want to add to that as well. Just if people are worried about friends, loved ones, need to find them some support or resources, what should they do right now?
It's extremely important, like Kim said, to touch base with your, whether it's coworkers, whether it's friends, whatever the case may be, people you meet in your recovery meetings, AA or NA. It's very important right now. One of the fastest go-tos, and when you start maybe head towards a relapse, is to isolate for a lot of people. And so making sure that is not crossed and you aren't heading that direction is very important. And we like to think that we do a very good job. And if we notice somebody in an Oxford House in particular, that we pull them out of their comfort zone and include them in whatever activities are going on.
Stephanie, can I talk about another project that's available for anyone in Colorado? Recovery Cards Project. I would love for people to go and check that out. Again, picking up the phone is wonderful. We also know that addiction is one of those things, it's stigmatized. I wish it wasn't, but it is. And people often don't know what to say. So we've got recoverycardsproject.com. You can go to that website and you can get a free card. It's a support card that you can send to someone that that might be struggling, and just letting them know that you're thinking about them. The messaging was kind of developed by people in recovery. The artwork was developed by Colorado artists, many in recovery themselves. It's a really wonderful way of just sending some support, especially when maybe face-to-face isn't as available right now during COVID. That message of support could be the thing that helps keep someone going on their path to recovery.
Yeah, I think a lot of people struggle sometimes with what to say, especially if they haven't gone through it themselves. You don't want to say the wrong thing, or, sometimes just saying something is beneficial, but you definitely don't, some people would worry about that, especially, if they haven't experienced it themselves. Michelle, I don't know if you want to add to that before I let everyone kind of get off of here. Just if people are worried about loved ones right now, what can they do?
Okay, yeah, I would like to just mention that we've talked a lot about recovery, and especially with abstinence-based recovery. And that is the most popular recovery, and it's the ultimate recovery. However, medically assisted treated recovery is just as valuable and offers just as much hope and changing of lives than just abstinence-based recovery. And I just want to put that out there because there's a stigma that exists with people that are being treated for opioid use disorder with medication. And it's important that people understand that medication helps people get their lives back, helps them restabilize their lives, get their families back, get their jobs back. This medication does not get them high. It just satisfies the brain so that the person is not suffering from withdrawals nor suffering from cravings, so that once they get to a therapeutic dose of the medication, they're able to regain their lives and without getting high. And I just wanted to put that out there. That hadn't been mentioned, and I just wanted to make sure that gets mentioned.
Yeah, Dr. Coley had mentioned a little bit about, there's some, pharmaceutical options out there that kind of help, but that's not always needed. Is that the case?
That's not always needed, no. But for opioid use disorder, it is the gold standard for helping people off of opioids.
Okay. Yeah, and I think this is what helps clear up like a lot of terms too. We talked about Recovery Month, and people might think that no matter what recovery is, it's always rehab. We were talking about different types of programs and all the things that are out there and available. So I want to thank everyone for joining us. I'm going to let all of you go because I think I've gone past the 25 minutes that I said I would keep you for. I did want to mention a few things. Dr. Coley mentioned this, but you can go to 9healthfair.org. We do have a couple mental health screenings, whether or not you're in recovery, but there's a couple free screenings on there that are just a good baseline for health, maybe before you reach out to someone else for help. You can take those again at 9healthfair.org. If you have a health question, whether it's mental health or you need to know more about these resources we mentioned, we have 9Health medical volunteers that are staffing our 9Health Neighbors line. You can call 303-698-4455, extension 2005. And within 24 hours, a medical professional will call you back and you can ask them really any health question you have, and they will find you the answer or the resource that you need. But again, I want to thank everyone for joining me, and we'll sign off from here. Thanks so much.
Thanks. Bye.